We are excited to welcome in the studio Dr. Malladi. She is one of the top minimally invasive bariatric and general surgeons in the entire Dallas-Fort Worth area. Doctor, welcome to the program, and let's get right into it. Who's the perfect candidate for bariatric surgery?
Well, obesity is a spectrum, and some patients need to lose a lot of weight and some patients need to lose just a few pounds. And bariatric surgery is meant for the patient who needs to lose a lot of weight. So we measure this by body mass index, which is a combination of your weight and height. It's a formula. And we look at patients who have a body mass index over 40 or a body mass index over 35 with other obesity-related medical conditions like diabetes, high blood pressure, heart disease. So that's one way that we look at candidacy for surgery.
All right, very nice. Now I hear that possibly insurance can help out. Is that the case?
That's absolutely the case. The only thing that people need to understand is that bariatric coverage is almost like having dental coverage. You either have it or you don't. It's not under general coverage. And so if a patient doesn't have coverage, then we can work with them with financial planning. But if they have coverage, then there are certain criteria that the insurance companies require you to meet. But in our practice, we help them understand if they have coverage and also to go through all the requirements to help them get approved.
There are different types of bariatric surgeries. Can you explain what is best? How would each individual know what is best for them?
Well, the most common bariatric surgeries are the laparoscopic adjustable gastric band, the sleeve gastrectomy, and the Roux-en-Y gastric bypass. And those three operations have different pluses and minuses. And I really encourage a patient to talk to their doctor because it's really based on the patient's medical and surgical history and some other medical conditions that they may have, because each operation affects medical conditions differently. And so I would say it needs to be a conversation with the physician involved.
Dr. Malladi, you are a minimally invasive surgeon, so what does that mean?
I actually did a fellowship in minimally invasive surgery because I wanted to make sure I could get the best outcomes for my patient. And traditional surgery requires a large incision.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.